live. We're rolling. We're rolling. All right. Hey, everybody. My name is Captain Ben Spencer, Training Officer, Columbus Fire Department. With me is...
Captain Mike Wilson.
Yeah.
Hello.
Today, we want to talk just a couple things about the COVID-19 response and about what we can do as like a community to help combat that. Yeah. First off, most importantly, try to keep social distancing as much as you can. 6 feet is what the CDC recommends. So we want to make sure that we do that. And that's very hard to do now just because of, as a society, we're so used to interacting with each other.
Right. And I think occupationally too, some jobs that are essential right now do require close contact or relatively close. So yeah, it's a tough thing.
Yeah. Police, fire, EMS, we all come in contact not only with our patients but with each other.
Right.
So that's kind of difficult to do. So social distancing by far is really going to help us out. The second thing we want to talk about this morning is hand washing.
Yes.
So I know I didn't realize how often I wash my hands throughout the day until this is being brought up about, hey, make sure you wash your hands.
Absolutely.
20 seconds is recommendation on how long you wash your hands. And I think a lot of people start the water, get the soap on, kind of, a little bit of this, wash it, and then they're done. But we really want to make sure everybody really gets in there and scrubs.
That's right.
Really scrub in the front, get back, use your palms to really dig in and get that dirt and grime off of there.
Absolutely.
So hand washing is very key as well. Cap, I want to talk about gloves.
Yeah.
So, seems like everybody knows how to put on a set of gloves.
Sure,
right?
Sure.
With winter gloves,
right.
Baseball mitts, gloves, that sort of thing. But specifically, we want to talk about medical gloves. Right.
Yeah. And right now, we're seeing a lot of citizens wearing gloves in the community. When we go to the store, when we're out and about in the community, we see people wearing masks and gloves, and it's important to identify proper use of gloves, particularly cross-contamination, which we know there's a lot of cross-contamination going on out there. Cross-contamination is where you don't realize that you're putting your gloves onto a potentially contaminated object, and then you're touching your face, you're using your cell phone. You've got a glove on that's infected, now you're rubbing your eye, you're touching other objects and leaving those germs on there. So, really, while gloves can be helpful, they can also be harmful. Hand washing, I'm telling you, hand washing and sanitizing, those are the keys. But if you're going to use gloves, when you put a pair of gloves on, it's very simple. Put the pair of gloves on that fits best, small, medium, large, extra large, depending on the size that you do use. And you just put a fresh pair of gloves on, as you do here. So now that you've got your gloves on, this is a tool that you're using. In the medical field, obviously, we're trained. This is our personal protective equipment. We try not to touch anything other than the patient. And if we soil these, we have the opportunity to get a fresh pair of gloves out in the field, and we would commonly do that. But if you're using these gloves through the course of the day, just keep in mind of what you're touching. Don't touch your face, absolutely not. But then again, to take these off properly, there are a couple different options. I'm going to show you one option right now, which is just simply the roll-off method. So what I'm going to do is I'm simply going to pinch the side of one here. I'm going to roll that off. I'm going to take it and hold the soiled glove in my hand. Now I'm going to take my finger here and I'm going to get underneath this glove, and then I'm going to take my finger, I've got underneath it, it's not contaminated under there, and I'm simply going to peel it out. Now, most important, this goes in the trash. This doesn't go on the street, doesn't go on your desk, it doesn't go anywhere but into the trash as soon as you as soon as you take that out. So discard that into the trash.
And Captain, you brought up a good point too. A lot of people looked at that and said, well, you're touching the glove, but you've already rolled everything that's contaminated on the outside on the inside.
Absolutely so.
Yeah. And so Captain showed you the roll-off method. There is a second method you can do. It's the pinch and the tuck method. So basically we're going to start out just like Captain started out here. We're going to pinch this, roll it down. Instead of rolling it completely off, though, we're kind of going to use the inside of the glove here to grab a hold of.
Yeah. And that's not contaminated. That portion of the glove is not contaminated, so
and
you're
then
safe.
We're going to roll that off and basically have the same type of outcome. Yeah, and a great point. You know, we don't want to just lay this down wherever. We want to make sure to dispose of it, right?
Absolutely.
And so with decontamination or using a wipe or a spray, you know, we really just want to dispose of these. We don't want to try to use them again.
Correct. Right? They're a single use only.
Yeah. So we want to make sure that we were going to throw these away.
Right.
So let's move on. So we've got hand washing. We've got gloves on. Let's talk about masks.
Yeah.
So at first, we were kind of with the CDC saying we probably shouldn't wear masks.
Right.
Now we're transitioning more. We're learning more about the virus.
That's right. Yeah.
We're learning more about it, and I think that's kind of what's frustrating a lot of times. Is, well, you said this, and now we're coming out with this, but we're learning more about it.
That is right. Yeah. So we're learning now that masks, in our emergency medical service realm, what we're using these masks for are for the patient when we arrive on the scene. If they are symptomatic, then we will provide them a mask from a safe distance and ask them to place that mask on. It's going to limit possible exposure. But we're also seeing, once again, folks in the community putting on masks and wearing them throughout the day as a means of protecting themselves. So there are lots of different masks available. We have some disposable masks, like the mask we have here. It simply is a mask that you would use, and it could be disposed of. Now there's a short supply right now, so a lot of people are using masks more than once. And if that is the case, if the mask is not soiled, then that is perfectly okay. What we would recommend is, after using the mask, that you would disinfect it with an appropriate solution, allow it to dry, and then it would be able to be used for a second use. And that's a personal mask. We're not talking about medical masks for patients. Obviously, those are one and done. So we don't want people to assume that we're only allowing our patients. We're reusing these for patients, and that's simply not the case. So this is an example of a disposable mask. It would simply go on. Keeping in mind when you're taking it off, we'll talk about that. But placing the mask on, this goes over the ears like such. You can adjust the mask, trying not to touch your face any more than you would have to. But now we have the mask on. Adjusting it is quite simply just moving it to where you would like to have it. And then we have the mask on to protect ourselves.
And one of the things, Cap, would on the nose piece,
correct.
How would I identify where I put the nose as where I put the chin?
So on the mask, as you can see, there is a section. Can you show that here?
At the top here, there's a piece of metal.
There is, and that is actually where the bridge is, where you can actually adjust that onto your nose, tighten that down if you feel like you don't have a good tight fit, and that's actually going to be the top of the mask versus the where the chin would go.
So if I'm an individual that really hasn't really worn a mask a whole lot, right? It's going to be kind of interesting,
yes,
for a little bit until I get used to
That's
it.
correct, and it can be it can be irritating. It can be irritating to your nose. It can be irritating to your eyes. Obviously, it's going to limit some of your breathing. You won't be able to take a deep breath in, and when you do, it will suck to your face. So folks that may have difficulty breathing anyway, this may be hard for them to tolerate a mask if they have a COPD or something of that nature. So keep that in mind as well.
Yeah. So and if I'm just an individual that is wearing one. I'm a healthy guy, right? I'm out there and I'm wearing one. It's going to take some time to get used to.
Yeah,
and the one thing that we want to reiterate is that once the mask is on, we don't want to be touching the face, because remember, just like our gloves, you could have a contaminant on the outside of the mask.
Precisely.
So adjusting it,
right,
that sort of thing. Maybe it starts to itch, so I will then, kind of do this with the mask and then go up and underneath to scratch. Kind of defeats the purpose.
Absolutely. Of once
mask.
Again, we emphasize, don't touch your face. If my hands were gloved at this point and I've been touching things, and then all of a sudden I reach up with my gloved hand and I pull this down, or I adjust, or I scratch my cheek, anything on my glove is now contaminating my face. And so once again, that's pointless. Touching the face is a big thing. We do it several times a day. So it's important to avoid touching your face, and just remembering to do that is very important right now.
Yeah. And I see too, we have a surgical mask that can be used as well.
Correct.
This is also a disposable style mask that you can get a hold of and use as well. I noticed that yours has just the loops around the ears.
Yes.
Whereas a surgical mask, you would have to tie it
around
the top of the head and then the bottom of the head.
Correct. Yeah.
As well. And let's talk about taking the mask
Very
off.
good.
So again, we want to make sure that we don't touch our face,
right,
as little as possible. So with these, the nice things about yours is, with the straps behind the ears,
right,
you're able to
That's right.
to remove that without touching the face a lot.
That's right. So I would want to do now, as opposed to touching my face again, was I would want to take my gloves off first and discard those. Then I've got my hands, which are not supposed to be soiled or infected with anything at this point. So what I would do then, reach around to the straps, pull them away, and simply remove it without touching the front of the mask itself. And then I could discard this into the trash. That is a reusable. We would be spraying this down with our disinfectant solution, allowing it to dry. And in doing that, once again, consider putting on another pair of gloves for that process. So we just have to think of all the steps of keeping ourselves safe right now. There are a lot. I mean, the cross-contamination is a real thing.
Sure.
And obviously, with the amount of testing available now and the increase in positive cases, we know that people are getting it somehow, even with mask and glove usage. So,
some other style masks that we have out here. I know a lot of people are talking about the N95 masks, right? And so we have just two styles here to show you real quick. Basically, it looks like your disposable mask. It does have two drawstrings, one for the top of the head and the bottom. Down here in the middle of the mask, it'll say N95. This one has basically it's in a rectangle, whereas this style of mask has it actually in a triangle at the bottom. And we want to talk just really quick. N95 masks, let's leave those masks for EMS,
Correct.
Fire, police, doctors, nurses, medical people, because you're supposed to have these actually fit tested.
that's right.
For an appropriate size, and not only that, with my common everyday going out, a simple mask, disposable mask, is sufficient.
Indeed.
Versus having a medical person or a police officer, a doctor, that sort of thing, coming in contact with people. We don't have the social distance. We have to come in contact with them. So we want to leave the N95s
for medical professionals and our first responders. Absolutely.
Yeah.
Yeah.
So I want to move on just real quick to some frequently asked questions that we get asked a lot as far as the fire department. And I think we covered some of this already, but we just want to kind of recap it real quick.
Sure.
So how often or how many times can I use this mask?
You can use the mask as long as it's a personal mask, as long as it's not soiled. You can use it more than once. Obviously, you want to maintain control that mask, make sure that it's not infected by another person. So using that sanitizing technique that you want to use, a Lysol type product, allowing it to dry, you can use that again. So
yeah. Cover your cough and sneezes.
Mm.
Making sure, hey, hands to the face.
Mhm.
We don't want that. We want to cover your cough, cover your
Right.
sneeze, and your elbow.
Absolutely.
And then, hand wash,
Mhm.
right?
Hand washing is key. I'm
Right.
telling you, is often
Mm-hmm.
hand washing.
And one of the things that we have here at the fire department, especially, started doing, I know
Mhm.
other departments are doing as well,
Mhm.
is taking your temperature.
Yeah. We identified that it's important to identify if you're first responders or any employee for that matter come to work with a fever. That might not be a good thing to do. So what we've had our department do, we were asking all of our firefighters to assess their temperature prior to reporting for duty. And then going through the CDC guidelines, we're looking at a temperature of 100.4 degrees Fahrenheit as being that temperature that kind of gets the red flag going. Mm-hmm. So we're instructing our firefighters at that point to stay away, stay home, monitor, and then if they have signs and symptoms that develop, obviously contact the hotline and seek out any additional some assistance. Mm-hmm. So we have also heard of many businesses in the community doing the same thing. Assess your temperature before you come to work, and then locally here at our department protocol is to also do a temperature assessment before we leave for the day. And then, of course, at any time, signs and symptoms develop through the course of your workday. It's important to identify that and to begin to distance yourself, and then take the appropriate steps to prevent the spread of the COVID-19.
Mm-hmm. And this virus, this COVID-19, it's tricky.
Yeah.
We have the normal signs and symptoms.
Mm-hmm.
Difficulty breathing. I can't catch my breath now, right? We have a fever.
Yes.
Fatigue ran down. Cough. What's bad about it is that those are the same signs and symptoms as the common flu.
Certainly are. We're seeing mild cases of these symptoms, and then we're seeing, the more severe. We're seeing those that are requiring some medical assistance to get through this. So, but the scary thing is, you are seeing asymptomatic individuals that are testing positive. So there are cases of that we're seeing. So you just got to be careful. That's the number one thing, and I'm telling you, social distancing, restricting any unnecessary travel, proper hand washing, sanitizing your hands as frequently as possible. Those are the keys to flatten this curve and to return back to normal. We're all ready for that.
Yeah.
But we have to do our part, all of us.
Yeah. And we'll get through it.
Oh yeah.
We'll get through it.
Absolutely.
And we'll bounce back. And we have maybe a longer way to go. Right.
Yes.
But I think overall, hey, we can definitely get through this. So
yeah.
Once again, my name is Ben Spencer, training officer at Columbus Fire Department. Thank you, Captain Wilson, for hanging out today and kind of going over some PPE and some steps. And we wish you all to stay healthy and have a great day.